Well, the month of June is National Scoliosis Awareness Month, and you might remember getting screened in school for this. And joining us live today is Dr. David Feldman. He is with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center. Dr. Feldman, thanks so much for joining us this afternoon.
Thanks for having me.
First, talk to us about it. What is it, and how common is scoliosis?
So scoliosis is relatively common. It can even affect up to 1 in 6 people. However, becoming severe scoliosis is pretty rare. So when they test for scoliosis in schools, oftentimes they're just looking for mild scoliosis, which is just a curvature of the spine to the side. That's how it's defined. So
what age group do you start to notice those symptoms of the rare kind?
Right. So the most common type of scoliosis is developed mostly in girls, and it's around the age of puberty, right before. So somewhere around the ages of 11 to 12 is when they start noticing scoliosis, and that's when it can become more severe over time.
And why is early detection so important then? I can't imagine that's why we do it in school, right?
Right. So we do it in school. We also, pediatricians do it oftentimes, and parents are instructed by their pediatricians to do it. And that's because there are many conservative treatments or non-surgical treatments for scoliosis these days that are pretty beneficial. There's even physical therapy routines, such as what's called Schroth therapy, which is a new therapy that were utilized just for scoliosis. That may have a bigger impact if we can diagnose this earlier on, when the curvature, which is measured in degrees, is quite small. And so we intervene with Schroth therapy, and then bracing if the child's young is quite good as well.
Have there been any advances in treatments, doctor?
So there's been a lot of advancements. One is that the physical therapy I just told you, which is Schroth. When I was training, and in many years of my practice, we had nothing to offer patients like that. The bracing is better, something called the Wood-Chenot brace, which is what we use. That's an advancement. I think surgical advancements with non-fusion surgery, such as tethers, or something called an apifix, which is trademarked from orthopediatrics. Both of those devices are some advances in the way we treat scoliosis, both non-surgically and surgically.
And any advice for parents out there?
I think the first advice is just don't worry if it's diagnosed. Don't get all upset. There's ways to treat this, and then you really just to follow up with someone who treats a lot of, if it's going to be a child or an infant or a juvenile or an adolescent, who treats a lot of scoliosis and has a center for it that allows people to be treated in all steps of fashion. So whether it's non-surgical with bracing or physical therapy or surgery, they get the full gamut of what can happen.
All right, Dr. David Feldman with Paley Orthopedic and Spine Institute at St. Mary's Medical Center, joining us live today to talk about this topic. Doctor, thank you so much.
No, I appreciate your time. Thank you.